Hi, my name's Jack Thomason, and I'm here today with Dr. Dan Greenwood. Hi, Dr. Greenwood. How are you?
I am well. How are you, Jack?
Good. With so much going on in dentistry today, I think it's rather confusing for potential patients. What makes your practice different from what's out there today?
Okay, well, first and foremost, our practice is a relationship-oriented practice. Basically, what that means is this, that we have your well-being is our genuine concern. We're going to take our time with you. We're going to deliver the highest quality of dental care. We're going to listen to you. We're going to answer your questions, and we're going to make sure that you're comfortable and confident in the treatment that you're receiving.
Oh, that's great. Very good. And how long have you been in practice, Dr. Greenwood?
I've been in practice for 17 years.
Good. And just one more question, like how would you differentiate your practice? I know you touched upon it briefly before, but like from an Aspen Dental, how would you say that your practice is different?
Right. Well, Aspen Dental and practices of that nature are very high volume. They're typically PPO practices, which means that they're participating in a lot of different insurance plans. And because of the level of compensation that they receive from the insurance plans, they really can't spend time with patients. I mean, to be honest with you, they spend as little time as possible to get the work done. Here at Greenwood Dental, I can assure you that would never happen. We take pride in the way we care for patients. We take pride in the amount of time we spend with patients. We use the latest technological advancements in a modern office to make your experience easier and better here. We are a CEREC provider, we use soft tissue lasers. All these modern advancements just make your appointment more efficient.
I see. Now, the services that you offer, you touched upon some of the technology, but how does that articulate into the specific services? What types of services? You know, there's so many different types of dental specialists out there.
Right.
You're a general dentist, correct?
Correct.
Well, what does that encompass, and how many different types of services do you offer?
Well, general dentistry is different from medicine, and the fact that when you're a general dentist, you can do whatever you want to do as long as you have the training for it and can handle whatever complications that may arise from the procedures you're doing. So, like, for example, when you're a general dentist, if you want to do root canals, you can do root canals. If you want to take out teeth, you can take out teeth. If you want to do a full arch of crown and bridge work, you can do that. If you want to do gum surgery, if you want to place dental implants and bone grafting, you can do all those things as long as you have the training. When you're a specialist, you have to limit your practice to what you're specializing in. And in general dentistry, you don't. Like, say, for example, in our office here, we do root canals. We extract teeth. We place bone grafts. We place dental implants, and we restore dental implants.
I see. So that makes it quite easy then for a patient to come and have all of these services in one visit or two visits right here at your clinic.
Absolutely. And patients love that. You know, I'm often asked, why did you start placing your own dental implants? And to be honest with you, I get tired of sending patients to other offices. You know, because when we were going through treatment plans with patients and I were explaining treatment options, a question that a patient would always ask was, well, can you do it? Why do I have to go somewhere else? And I just got tired of sending them somewhere else.
Ah, I see. That's nice. Okay, so your services, you offer a host of different types of services. What if I'm a family that has, you know, a big family? Are families welcome here? I mean, is this a place where I can bring my children?
Absolutely. You know, we see multi-generations of families here. In an average day, we'll see pediatric patients, we'll see geriatric patients. You know, the practice was started back in the early 70s under Dr. Ronald Sveda, and we still have some of those patients here today. So in an average day, you know, I'll see preschoolers, I'll see teenagers, I'll see retirees. So we're capable of handling all of your family's needs here.
Now, I know that there are a lot of patients out there that are nervous about coming to the dentist. What can you say to those patients that, you know, perhaps would not come, but knowing that you do different services?
Right. Well, we have a solution to that also. Here at Greenwood Dental, for patients who have a high level of anxiety, we use oral sedation. Basically what happens is a patient takes a tablet of medication we prescribe for them prior to their appointment, and it just relaxes them, takes the edge off. We get a lot of work done with that we would not otherwise be able to do. Because some patients are very nervous. I mean, let's face it, this is not the, most patients don't like going to the dentist. Even if you're not nervous about it, most patients don't like going to the dentist. So we really cater to our patients. And whatever that patient needs is what we try to fulfill.
That's great. How does a patient go about paying for their dentistry in these times? We're living in a very difficult economy,
Yes.
and should a patient forego coming to the dentist just because of, say, like a lack of insurance or so forth?
No, finances should never be a reason not to be at the dentist and receive the standard of dental care. And here at Greenwood Dental, we do everything we can to try to ease that burden as well. We process multiple forms of insurance. We accept multiple forms of payment. We even have financing available and payment plans. So we do everything we can to make that a little easier as well. And when you take into consideration, the quality of care that you're receiving, the amount of time we spend with patients is an exceptional value.
Good. And could we just one more time talk a little bit about the benefits of coming to a high-tech office such as yours, the benefits to the patient?
The benefit is essentially just summed up, and it makes the patient visit go smoother, quicker, efficient, and easier. Because with modern advancements, I can do things now in a single appointment that maybe took 2 appointments to do before. Let's say, for example, we are a CEREC provider, which means that we can provide a crown, a porcelain crown, or porcelain veneer in a single appointment. And everybody's busy in this day and age, and nobody wants to miss work twice to come to the dentist. So there's just one example. I can provide a crown for you in a single appointment.
Very good. And what about emergencies? How do you handle emergencies in your practice?
We try to see emergencies the same day that they call. We have emergency hours are available, and we always try to accommodate emergencies as quickly as we can. Usually we set time aside daily for those. And if it's after hours or on a weekend, I can always be reached on my cell phone.
And one of the things that I know is interesting is the staff. Tell us a little bit about your staff, and has the staff been with you for a long time?
Yes, they have. They've been very fortunate. I have a great staff. We have very low staff turnover. Our newest staff member is Debbie at the front desk, and she's been here for 7 years now. The other staff members have been here since before I came into the practice, so they've been with me for 14, going on 15 years now, which is comforting to know. You're going to see the same faces every time you come in here. It's not a revolving door of employees, and that gives you a good feeling as you're going through your treatment.
Wow, that sounds really great. And I know that you're here in Sagamore Hills. Do you want to just tell prospective patients about your location and how convenient it is, and parking and so forth?
Sure. We're located on Route 82, right across from Ferfolio Funeral Home in Sagamore Hills, Ohio. And parking is very convenient. It's a one-floor building. The parking is right outside the door. It's great accessibility from I-77 or 271, and it's an excellent location.
Well, Dr. Greenwood, I really appreciate the opportunity, and I hope that all the patients that you see will really experience the great service here at Dan Greenwood Dental. Thank you, Dr. Greenwood.
Thank you, Jack.
Thank you.